The goal of this video is to demonstrate the CAM ICU, the confusion assessment method of detecting delirium. It's a 4-part tool we can use to detect delirium in the ICU. It should be integrated into your neurological assessment every morning and with any mental status change. Our history is we have a 49-year-old patient admitted with sepsis. Your report from the night shift was she is calm, collected, cool, and she is seeing spiders on the wall. Her white count is 6. She's afebrile. The sepsis looks to be resolving. Prior medications include Xanax as needed and a glass or 2 of wine. That's the only prior medical history. So let's proceed with our CAM assessment. Step 1 is there an acute or change in mental status? Obviously, the spiders on the wall is not normal. There has been a change. So step 1 is yes or positive for delirium. Step 2 is a very simple questionnaire that you can be done in 10 seconds or less. Hello, I'd like to ask you some questions to see how clear you're thinking this morning. Can you squeeze my hand, please? I'd like you to squeeze my hand when I say the letter A. S, A, V, E, H, A, R, T. Thank you. Obviously, the patient has made more than 2 errors in the Save a Heart. She is definitely delirium positive. So we have question 1, delirium positive. Question 2, delirium positive. We move on to question 3 then, which is our sedation agitation score. Anything but a 4 is considered delirium positive. Looking at this patient, she's picking at things, she appears anxious. Her sedation agitation scale, I would say, would be a 5. Part 4 of the delirium agitation scale or delirium scale is a series of yes and no questions. Will a stone float on water?
What?
Does 1 pound weigh more than 2 pounds?
Pounds of what?
Okay. Are there fish in the sea?
Well, sure.
Okay. Can you use a hammer to pound a nail?
No.
Okay. Can you hold up 2 fingers on one hand, please? Okay. Can you hold up 2 fingers on your other hand? Obviously, there have been more than 2 errors on this questionnaire. So your patient is considered delirium positive on this question also. So she's delirium positive, you charted it in your chart. What do you do next? You involve your physician, you involve multidisciplinary team, you involve pharmacy, you look at nursing interventions that could see why did this happen. In this particular instance, it's a replica of a case study we had last week in our hospital where the patient took Xanax at home but was not restarted on the Xanax in the hospital. And once the patient was restarted on Xanax, her delirium resolved in about 12 hours. So this patient's history included taking Xanax at home, and we have not restarted that. So basically, she's going through benzo withdrawal. Now, let's do a different patient. We have a 49-year-old, knee replacement, post-op day 3, moving along swimmingly, just following the pathway, projected to go home in 2 days. So by your question 1, you know by your report that she's alert, oriented, cooperative with cares, asks appropriate questions. So we know question 1 is no, negative for delirium. Question 2 will take about 10 seconds at the bedside. Hello, I'd like to ask you some questions about how clear you're thinking this morning.
Well, sure.
Okay, would you take my hand, please? And squeeze when I say the letter A. S, A, V, E, H, A, R, T. That's all. Thank you much. So for most of your patients, 90% of your patients, the delirium screening is going to take 10 seconds or less. this is how the delirium scale is done, and thank you for your attention.